Monitoring DMARDs in primary care. Although this follows national guidance, it does not replace individual assessment, specialist advice, or locally agreed protocols. The majority of DMARDs, once on an established dose, are monitored every 3 months, with a full blood count, user needs, and LFTs. Specific DMARDs require extra considerations, such as leflunomide, where it's important to also review blood pressure, and also hydroxychloroquine, where you should also inform patients to report any new eye symptoms and seek an annual eye review after 5 years of continuous use. It's important to be aware of specific cutoffs on blood tests, so if you have the time, have a look at the guidance yourselves, but be extra cautious when patients report new symptoms, such as a new onset cough or shortness of breath whilst on methotrexate, or if you're experiencing a sore throat or presenting very unwell. In these situations, use your clinical judgment and don't hesitate to seek urgent advice from secondary care. Some other important considerations for patients on DMARDs include if planning for pregnancy, to see if a washout period or medication review is needed, but also chickenpox exposure, if proven to be non-immune. Now, here's an important slide on when to refer patients on DMARDs. In terms of lab results, if you find that there's any evidence of neutropenia, thrombocytopenia, eosinophilia, macrocytosis, renal impairment, deranged LFTs, or even a drop in the albumin, take a moment to think, does this need actioning urgently, and how would you monitor this? All of this information can be found on NICE CKS as well, but also take some time to also think, if patients are on DMARDs, there can be presentations that you see commonly, such as a rash, a mouth ulcer, sore throats, or even abdominal pain. You may have to take extra care when assessing these patients just because they are on a DMARD and high risk of immunosuppression. I highly recommend reading the following references and resources, but next time you see a patient on a DMARD, remember the extra precautions you may need to take during your routine reviews.